Dominic Cummings today, still wanting people to follow him. 2 weeks ago, he suggested excoriating questions for the latest pandemic lessons learnt session with MPs, all to be bowled at the Health Secretary in another attempt to get him out of a job.
Is it your chance to give the version of events today, Mr. Hancock?
The session turned out to be less explosive, but more important than it had been billed. He began by rattling through denials of the specifics put to the committee 2 weeks ago, of lying, including to Boris Johnson.
Did you ever say anything to the Prime Minister that you knew not to be true?
No.
Today mattered because Matt Hancock discussed not whether things went wrong, but why. The Health Secretary appeared to accept the government lockdown later than it might have done, but stressed he personally was across the scale of the challenge as early as January last year.
I was given the planning assumption based on Spanish flu, and it was signed off at Cobra on the 31st of January. And that was a planning assumption for 820,000 deaths. And I was determined that that would not happen on my watch.
MPs in the inquiry today told us what their conclusions are going to be. They think we locked down too late last March, there wasn't enough testing early on, and they're probably going to find that we shouldn't have sent patients from hospitals direct to care homes. What was interesting, though, was Matt Hancock didn't reject those findings. Instead, he tried to give context, background, even shape who people should think got the blame.
One of the major charges levelled at ministers is that care homes were deluged with patients with coronavirus direct from hospitals. Matt Hancock said that he was so concerned that those without symptoms might be ill that he put in calls all over the world to find out more.
I was so worried about it, I arranged a call with the World Health Organization, and I was told on that call that with respect to China, this was likely a mistranslation. I bitterly regret that I didn't overrule that scientific advice at the start and say we should proceed on the basis that there is asymptomatic transmission.
The global scientific consensus might have been wrong, but the UK's own government scientists warned in January that they had found limited evidence of asymptomatic transmission. Care home staff also complained to Sky News that they lacked personal protective equipment, PPE. But today, the Health Secretary said,
despite local challenges, and I don't deny at all there were challenges in individual areas, there was never a national shortage of PPE because of the action that we took.
And yet a report into PPE by the government's own watchdog found many frontline workers in health and adult social care reporting not having access to the PPE they needed during the height of the shortages. Learning lessons to avoid more scenes like this. But key players still very careful to make sure the finger of blame doesn't point at them. Sam Coates, Sky News.